Bismillah Rahman Rahim. Assalamu alaikum. Do you know that schizophrenia affects nearly 1 in 300 people worldwide, yet it is often misunderstood? When people hear that the word schizophrenia, they often think of someone completely out of touch with reality. But did you know that it's a complex mental health condition that affects how someone thinks, feels, and behaves? Today, we are talking about schizophrenia, a condition surrounded by myths and misconceptions. My goal is to help us understand it better so we can be more empathetic and supportive. I want to share with you two case histories to simplify the concept of schizophrenia and highlight the importance of early diagnosis and treatment in a relatable way. Let meet Sami, a young adult whose journey with schizophrenia shows the importance of understanding and compassion. Sami is a 22-year-old college student who started showing unusual behaviors. His friends noticed he was withdrawing socially, often talking to himself, and seemed paranoid about being watched. Analyzing his symptoms, he had positive symptoms, negative symptoms, and cognitive symptoms. By positive symptoms, I mean things added to Sami's experience. And these included Sami often heard voices that others couldn't hear, telling him he was in danger. He believed his professors were sending him secret messages through emails. The negative symptoms, meaning things taken away from Sami's usual behavior. These included he stopped attending classes and avoided his friends. He showed little emotion and stopped enjoying activities he used to love, like playing cricket. The cognitive symptoms included that Sami struggled to concentrate and found it hard to organize his thoughts, which made studying almost impossible. The diagnosis and intervention. Sami's parents noticed his behavior changes and took him to a psychiatrist. After a thorough evaluation, he was diagnosed with schizophrenia. Treatment plan for him, it included medications. Antipsychotics helped reduce his hallucinations and delusions. Therapy, he started cognitive behavior therapy for psychosis, where he learned to challenge his delusional thoughts and develop coping strategies. And the third component was that of social support. A social worker helped Sami reconnect with his friends and resume some of his college activities. Results and recovery of Sami. Over time, with consistent treatment and support, the voices became less frequent, which he used to hear, and Sami started to recognize when they were not real. He re enrolled in classes, focusing on a lighter workload. Although he still had some challenges, Sami learned to manage his symptoms and live a more fulfilling life. So, the takeaway from this case histories, Sami's journey shows that with early intervention, treatment, and understanding, people with schizophrenia can lead meaningful lives. Second case history is that of Mr. Zahir. Zahir is a 25 years old college student who had always been quiet but performed well academically. Over the past year, his family noticed he had become withdrawn and started acting strangely. Early signs. At first, Zahir began isolating himself from his friends and family. He stopped attending classes regularly and spent long hours in his room talking to himself. When asked, he said he was communicating with special beings that only who could hear. Escalation of symptoms. One day, Zahir told his parents that someone was spying on him through the TV. He became suspicious of people around him and thought his food was being poisoned. He started avoiding meals and refused to go outside, believing he was being followed. Symptoms observed: hallucinations, hearing voices that were not there. Then delusions, believing he was being spied on or followed. Disorganized thinking, difficulty answering simple questions, and often speaking in a confused manner. And fourth, social withdrawal, avoiding interaction with others and neglecting personal hygiene. Seeking help. Zahir's parents took him to a psychiatrist after realizing these changes were not normal behavior. After a thorough evaluation, he was diagnosed with schizophrenia, which is a chronic mental illness that affects how a person thinks, feels, and behaves. Treatment journey. Zahir started a treatment plan including antipsychotic medications, and these helped reduce hallucinations and delusions. Then, psychotherapy supported Zahir in managing stress and improving social skills. Then, family counseling educated his family on how to provide support and understand his conditions. This is very, very important that the family should be counseled. And lifestyle changes, regular sleep, exercise, and a structured routine to manage symptoms better. The current status of Zahir, with consistent treatment, Zahir's symptoms improved significantly. While he still requires regular follow ups, he has resumed his studies and is rebuilding relationships with his family and friends. Key message from these two case histories: schizophrenia is often misunderstood, but it is a manageable condition with the right treatment and support. Recognize the symptoms early, and these are hallucinations, hearing or seeing things that are not there. Number two, delusions, false beliefs, like thinking you are being followed or harmed. Third is disorganized speech or behavior. And fourth is social withdrawal and lack of motivation. Myth busting: schizophrenia is not the same as split personality. It is treatable, and many people can recover significantly with help. Sami and Zahir are not defined by their diagnosis. They are young men with dreams and challenges, just like anyone else. So, the stories of Sami and Zahir remind us that mental health conditions like schizophrenia are not the end of the road. With the right support, people can overcome challenges and thrive. Let's break the stigma and build a more understanding world. If you or someone you know is struggling, don't hesitate to reach out to a medical health professional. Early intervention can make a huge difference. Schizophrenia is a mental health condition that affects how a person thinks, feels, and perceives the world. It is not about having a split personality, as often misunderstood, but rather a complex brain disorder that can include symptoms like hallucinations, delusions, and difficulty organizing thoughts. One common myth is that people with schizophrenia are violent. In reality, most are more likely to be victims of violence rather than perpetrators. Many people with schizophrenia lead meaningful lives with the right treatment and support. For example, I've seen patients transform with early intervention and consistent care. Schizophrenia does not have a single cause, and while it cannot be cured, it can often be managed effectively with the right approach. What are the causes and risk factors for schizophrenia? There are many, and these include genetics, brain chemistry and structure changes, environmental factors like prenatal exposure to viruses, substance abuse, family history of schizophrenia, and trauma or stress. What are the types of schizophrenia? At least five types are there: paranoid schizophrenia, disorganized schizophrenia, catatonic schizophrenia, residual schizophrenia, and undifferentiated schizophrenia. What about the symptoms of schizophrenia? There are positive symptoms, there are negative symptoms, and there are cognitive symptoms. So, three sets of symptoms are present in schizophrenia. The positive symptoms means something they see, they feel, which are not there. Hallucinations. It may be auditory hallucinations, visual or tactile. That what they see, it's not there, but they see, they hear, and they feel. Then delusions, like paranoid delusions, grandiose delusions, and bizarre delusions. Disorganized thinking and speech, and agitation or aggression. All these are positive symptoms of schizophrenia. The main difference between hallucinations and delusion is that hallucinations are sensory experiences, while delusions are false beliefs. I explain it further. Hallucinations, a person experiences something that is not there through their senses, such as seeing, hearing, tasting, smelling, or feeling something. For example, someone might see a deceased one in the room. That yes, I see the person who died 4 years ago is in my room. Delusions. A person has an unshakable belief in something that is not true, even when presented with evidence to the contrary. For example, someone might believe they have special powers or that their partner is in love with someone else. Both hallucinations and delusions are manifestations of psychosis and can occur simultaneously. They can have similar causes, diagnoses, and treatments. Someone having addicted to substances like alcohol, marijuana, LSD, and cocaine, they can cause hallucinations during intoxication and withdrawal. What about the negative symptoms of schizophrenia? These include flat affect or emotional unresponsiveness. I'll explain this further in a short while. Then social withdrawal or isolation. Then poverty of speech or lack of motivation and impaired cognitive function. The flat effect in medical terms means the inability of an individual to show emotion via facial expressions, body language, or tone of voice. Individuals exhibiting flat affect lack an emotional response to stimuli in their environment. The cognitive symptoms of schizophrenia include impaired attention and concentration, memory difficulties, and difficulty with problem solving and decision making. How we diagnose schizophrenia? By comprehensive diagnostic evaluation and psychological assessments, and taking the medical history, doing the physical examination, and applying diagnostic criteria DSM-5 or ICD-11. What about the treatment of schizophrenia? As I explained in those two case histories, the treatment includes medications, psychotherapy, lifestyle changes. The medications are antipsychotics, the first generation or the second generation, and antidepressants for co occurring depression. The psychotherapy includes cognitive behavioral therapy, family therapy, group therapy, and social skill training. The lifestyle changes, which are very integral to the treatment of schizophrenia, and these include regular exercise, healthy diet, stress management, social support, and sleep hygiene. So, if you know someone who might be struggling, reaching out with kindness can make a world of difference. Schizophrenia is just one part of a person's story. It does not define them. So, together, we can break the stigma and help those affected thrive. So, please share your thoughts, your queries, and if you have got any experience of being in contact with schizophrenic patient, in the comments below of this video, and I will try to answer all those queries and comments. Thank you very much. See you in the next vlogs on the series of psychiatric and psychological disorders, and our next vlog will be on the personality disorders. Thank you very much. See you in the next video.